I'm recording.
All right, so yeah, for the article that was sent out this week, it was the return to sport and patient satisfaction at a 5-year follow-up after non-operative treatment of acute Achilles tendon rupture. So they wanted to look at how well the procedure itself works without surgical intervention. And so they assessed the 1-year and 5-year return to sport for patients with the acute Achilles tendon rupture, meaning a full tear, not a partial tear. It was a retrospective observational study, and it looked at initially 114 patients, but out of those, some were excluded because they just didn't follow up, or they didn't fit the criteria, and the final number was 89 patients between 1996 and 2012. So the non-operative protocol they used included a rehabilitation boot, which was placed on the patient. Initially, it had a 20-degree plantar flexion, meaning it basically looked like you were walking on a heel, like the high heels. That's what the boot looked like. And that angle was progressively decreased in 3 stages as the patient recovered. They were also administered heparin daily, and they underwent a physical therapy regimen. And after 1 year, the patients were allowed to place full weight bearing on the ankle and return to their sports activities. And they were doing a follow-up 1 year and 5 years after the injury. They also had to answer a survey based on the satisfaction that they perceived in the treatment. They compared different sports, and they categorized these into 2 groups, high activity group and the low activity group. And they did the survey both at 1 year and 5 years. So the results for that, the 1 year follow-up, when they did the statistical analysis, only had a p-value of 0.71, which meant it was not statistically significant. However, the 5-year follow-up had a p-value of 0.029. And they reported that subject satisfaction was good or very good in both the low and high activity groups. Some of the complications that occurred during the study is that 11 patients had re-ruptures of their Achilles tendon at the around the 9-week mark, give or take 3 weeks. So there was a bit of range, but that was the 9-week mark was the mean. And overall, 70% of the patients returned back to their previous sports activities. And they also looked at the differences between the high and low activity groups. And in the low activity groups, the return to sports was significantly higher, around 91%. They also compared the high activity group to athletes who underwent surgical intervention. And now for that, the surgical intervention had a better return rate. 82% of those patients returned to their to their sport, which in this case, they compared it to soccer players. So in that sense, the return to sport is lower for non-invasive. But again, we're comparing, athletes and high performers. So the main takeaway is that for the general population who is, not a super athlete, for those people, the return to sport was 91%, which was a good percentage. So that was it. They did not declare any conflicts of interest. And yeah, that's it. Are there any questions?
Wow, that's actually
You did a great
impressive.
job.
Yeah.
Yeah, I read the article and I thought it was very good. I had one concern, like well, one and a half, was the scale that they used to differentiate the different levels of athletes. I think it was a TAS scale, and it was above 6 would be considered like a high performing athlete, but that wasn't really that high performing athlete. It was only when you reached 9 or 10 is when you were hitting sports like soccer, football, jumping sports like volleyball. So like I want to know how many of those people were more so in that 6, 7, 8 range, or more people that was in that 9, 10 range. Because to me, there's a big difference between a leisurely jog and football. So that both of those shouldn't be in the same category. And then obviously any study you do retrospectively is going to have like a little bit of skewed data because of it's opinionated. You're going off of memory and things of that nature. There's a lot more room for variable, but overall, I think that it did a very good job at trying to like put more scrutiny on possibly trying conservative treatment before going to surgery, because it really depends on what your goals are. And but it did make it seem as though surgery is the better move for those people that would be putting like high strains on the Achilles tendon. So overall, I liked it.
Yeah, so out of those 11 patients who had re-ruptures, 6 of them continued on with the non-operative treatment and eventually did recover, and only 2 of them underwent surgical intervention. So it could be that you can offer up a patient the option to just try the boot first and see how that works for them if they're hesitant to undergo surgery.
Yep.
Interesting.
Piggybacking off of what Will said, after they spoke about the TAS scale, they also said that most of the reporting wasn't a pre-injury to post-injury comparison. It was just kind of like a patient-reported outcome response, which was not really efficient in terms of seeing how well they bounced back. So I'd be interested in seeing their levels of athletic performance before the injury and how well they measured up to those performances after the injury. I don't think this study really specifically focused on that, but I think that'd be an interesting turn to take this if we were to re-examine it.
Yeah, so the when they were comparing the athletes to the high activity group, the measurement that they used for the athletes was a meta-analysis, and they did mention that the reporting across all of the articles for the athletes weren't really consistent, and not all of them used the same ways to measure their return to sport and their performance. So yeah, there's some issues with the way that was reported. It's just that they did not find any better measurements that were out there in the research.
Just to piggyback off what Travell said regarding the questionnaires and the patient-reported outcomes, I think there's a high chance of like subject bias also. Also given the sample population where a majority of them were men, I think there could be a tendency where they could have reported the answers or what they were, or the questionnaires just based on the perception of what they thought the researchers wanted to hear. So that could have also influenced the results. And I feel like they should have gotten more people that would have improved the power of the results. Make like the male to female ratio kind of balanced. It was like heavily skewed towards the males.
It did say that the injury is more common in male patients, though.
Yeah.
Those are some good points. I agree. I think that's one of the issues that you have when you do self-reporting, especially if it's not done in the double blind, is you could be tailoring your answers with skewed opinion based on emotion, or we're trying to fulfill research, or whatever biases you may have. So I think that's some good points. And Christine, yeah, you're right. It is more likely in males, but the question that I immediately thought of, because I haven't done research on why prevalent, is lifestyle. I don't know if lifestyle has a choice in that, because I know that men tend to do more dangerous things, particularly, but also women do play sports just as much as men. So I don't know if that has anything to play into that. So that's something I'm actually gonna look up after this. So
Yeah, going off of Will, I just wanted to share one thing. It's a good article. It's a quick read, and I wanted to say one thing I was looking forward to was knowing what was the reason behind why those people that had a rupture. Was it because of nutritional status? Because healing, if a person has good nutrition, healing can happen. But if the person has bad nutrition, comorbid, or other diseases and stuff like that, then that affects healing a lot. Like a diabetic patient will not heal at the same level as a non-diabetic. So I don't know if the study really, I didn't read anything about it, but was there a standardized method of the level of fitness of the people participating, or did they not cover that? Because if they didn't, a future follow-up study could be something like this, that, okay, all these people were either diabetic, or all these people were either healthy, no other comorbidities. So that way kind of just like standardize the field.
yeah, I totally agree. And I think like certain drugs need to be taken into consideration. Like I know some quinols will deteriorate your tendons and make you more likely to rupture. So it's another big thing that they need to address. Did you see that anywhere, Andre? Did they specify the type of patient that they chose outside of what their activity level post the research was?
Like maybe BMI levels should be addressed.
Exactly.
That also affects the healing of, because the more weight you have on the feet, the less healing potential. Or did the patient rest, ice, all that stuff? It adds up.
Yeah.
Yeah, I think even as far as recovery, I mean, even for us to know in the future when we're treating athletes, is this a college athlete who has trainers and physical therapists on staff throughout their recovery, or is it just someone who, yes, is competitive, but maybe doesn't have the access to all these people who can help them?
Yeah.
Right.
Yeah,
So
100%.
in the study, they did not mention what the inclusion criteria was, only what the exclusion criteria was. So basically they excluded anyone who underwent previous surgeries, who had partial tendon tears or bilateral injuries, people who refused to participate, which, or had degenerative rupture without any significant trauma or continued treatment elsewhere.
Well,
That's very limited. Very.
it did say that they limited it to people that presented within 48 hours. So if they were outside that 48-hour window, then they were just put they were given surgery instead.
Yeah. Sure.
Yeah, so it was only acute tears.
Something that came to my mind was like patient reliability. Like, are they following the physical therapy regimen to a T, or are they doing more activity, less activity? Is this why they're having like the re-ruptures or not healing to full capacity, trying to do stuff on their own? So that sort of thing.
Yeah, there's a lot of variables. So that's a good point, Anthony. Yeah.
They did report that the physical therapy that they underwent was done either at a clinic or at home, but it was done under supervision.
Yeah, going off the physical therapy notion, there's like at least, I would think off the head, maybe 5 or 6 modalities you can use just to help healing, whether it be like TENS or ultrasound. So did every one of these patients have the same physical therapy, or were there like different types of physical therapies? Because every physical therapist has their own preference in what they want to treat a certain patient with. And for a tendon rupture, there's more than 5 or 6. So there's a lot of variables that I feel could have been included, or at least reported, so we can have like, okay, cause and effect. This is why this person had this, so this is why this group had this.
Yeah, so they all followed the same protocol, and it was what is it called? The weight-bearing treatment protocol described by Ecker et al. So they cite that protocol, which admittedly I did not look into.
That's a good point, but what Junaid and kind of Shanae said, that I don't think the protocol doesn't necessarily, don't quote me because I didn't look into it either, but usually a protocol has to do with more so the exercises, stretches, soft tissue, deep tissue exercises, as opposed to the modalities like laser, ultrasound, and TENS, which I know college athletes, we all have access to, but I know certain outpatient clinics absolutely won't probably have a laser machine because it's at least $10,000, $15,000, $30,000 at times for one machine. So I think the modalities, people understate how much that could accelerate healing. But that may be a part of the protocol. But usually when I've looked at protocols, it's more so physically what you're doing.
Didn't it also say that all but one of the patients were recreational athletes? So wouldn't they really not have, I mean, I played recreational sports when I was a kid, and like, I didn't have PTs on the sideline, you know, just my dad. So like, I'm sure a lot of them probably didn't have access to lasers, and like their rehabilitation is probably different than that one eliteist athlete or whatever. So.
Yeah, these were all quote unquote normal people, not pro level athletes. They only did the comparison to the pro level athletes and high activity group, but I don't think they didn't claim that was like a one-to-one comparison. Is more so just to put it into perspective, I think. Yeah, those athletes do have access to a lot better facilities and means of recovery than someone that's just, you know, off the street playing basketball.
All right, just a heads up, we have 4 minutes left before we get kicked out. So I don't know if anybody wants to have any last minute comments or concerns or anything like that, but I think we had a very successful meeting. I'm actually gonna stop the recording. I'm just gonna recap